Good afternoon, everybody. My name is David Mkefa. I come from Orlando East, in Soweto, in the province of Gauteng. Cancer damaged my vocal cords, but I'm doing a lot of speaking now, ever since I had cancer. Cancer doesn't belong to any race or nation. It is a global problem. You are rich, you still have cancer. You are poor, you still have cancer. Cancer knows no boundaries.
As a young doctor, young mother, to be diagnosed in the most advanced stage possible was almost inconceivable, and yet there it was, my reality. Living with cancer is not an easy journey.
I was alone. I have no family. Who'd you turn to? Your friends are great, and they say, look, if you need me, I'll be there for you. But at 2 o'clock in the morning, 3 o'clock in the morning, you can't ask that of them. I'm not the only one experiencing this. There's the dude in Russia, or the little child in Malaysia, or the mother in Kenya. Cancer needs to be a global fight.
Cancer is a huge problem, and it's a growing problem.
Cancer does look different from country to country because people are different around the world. Cancer is a personal issue, and the more that those personal stories can be provided in the right types of forum, the more that we'll be able to really understand the complexities of cancer.
We really see a patient forum as the first step in opening a national dialogue on cancer.
Stories have an effect on policymakers because you realize how widespread these stories are. You can put all the data you want in front of a government official or a health minister, but it's the stories that are going to touch people.
Hearing those stories is just vital to actually motivating people to make the changes we need to see. We think it's very important to work at the country level with the survivors and people who are there on the ground experiencing cancer in that environment.
And from there, the work really starts. Every country can benefit from conducting a patient forum.
A patient forum is planned and implemented with cancer patients, healthcare professionals, local nonprofits, governments, and advocates.
A patient forum is really a unique gathering of stakeholders within a country to get patients to speak about their experience with cancer, what they went through.
There is stigma in South Africa. Some people, they were scared to touch me. To share my story is very important. Hi everyone. My name is Sia.
It's a great way to empower them, and I think that empowerment is probably the key to any forum setting.
The patient forum can be customizable. It is usually organized around a series of topics: prevention, diagnosis, treatment, palliative care. Also, someone has to be responsible for the details of it. If you can find an organization who's willing to take the lead, who really believes in the ability of a call to action that comes from a lot of people rather than maybe just their organization, the lead agency really has a chance to make a real difference.
Part of why the South African environment is so tricky is because we have all these different cultures.
We have 11 official languages in South Africa. That's a lot. That's a lot, but that's what makes South Africa such a wonderful country, because everyone has to be represented. In South Africa, we always associate cancer as a white people's disease.
Or a privileged illness. You know, it only affects those that are wealthy in that.
We have to acknowledge the inequities created by the apartheid regime. We have progressed in terms of improving access to care, but we can do a lot more.
In South Africa, we're going to be having the first Survivor Forum. We've chosen to call the Survivor Forum the Voice of Cancer because it's a platform where patients and survivors can tell their story.
I'm very excited to be involved in this because all the cancer NGOs from around South Africa are coming together for the first time in years.
The forum starts off here in South Africa with a survivor and media training session, which I was very excited about, as it gave an opportunity to really just kind of train survivors about how to tell a story. Not everybody is familiar with that.
Session 1, we're looking at setting the stage of cancer burden. Your story, your personal story.
The media has a huge role in helping to change the direction of cancer care and cancer burden in South Africa.
It's got to be appropriate to your audience, and they must be able to relate to empathize with it.
And then the forum starts, and the forum then has all these stakeholders there: the government, the NGOs, the media, the survivors, the caregivers, the oncologists, professional and lay people.
I'm going to speak at a forum about my experience as being a cancer survivor as well as a medical doctor. I'm really excited to share my story because I hope it'll help other people.
A forum is different in the sense that it's not just about theoretical discussion. It puts heart to the story. It gives face to the problem.
So what do you do as a young mommy to a gorgeous 4-year-old daughter when you have a 5% chance of being alive within 5 years from diagnosis?
You know, we all want to achieve the same goal. So it was an interesting forum that it brought a lot of people together that were otherwise operating in silos or individually.
It is therefore a huge benefit for government to be seated within this forum.
The question goes to the Department of Health. Is it possible to advise what type of timelines we could be looking at?
Working as a collaborative NGO force often allows your voice to be heard by the government. By working together and as a collective, we're stronger.
I can't imagine doing this without access to the financial and emotional support that we have.
I am humbled by listening to the survivors here today who actually showed me the will of the human spirit.
It's personal, but it's also done in a context. You point out the problems, really, the gaps maybe in the service, problems in the system, and you start to see some consistency across that. A patient forum results in a call to action so that changes are made within that country. We think these things that are in this call to action will really make a difference, and we're all going to work on this.
Sitting here this morning, seeing those 32 survivors sitting there, knowing what it took to get them there, made me feel proud.
Collaboration is not easy. You need passion, you need time. It seems a mammoth task when you begin, but if you chip away at it bit by bit, it becomes the most rewarding journey you will go on.
You need people from within to start working together and collaborating together and sharing their stories so that you can affect people from inside. So it's like a bomb, you know, and then suddenly it just explodes, and then it can get out internationally and globally and all of that.
We've seen patient forums happen in France and Italy. Turkey is implementing patient forums regularly now in South Africa, and this is expanding to other countries. It's very exciting to see that coming together. We've seen that this is effective, and we've seen tremendous success in other countries, so we'd like to see patient forums happening in every country around the world.
It's so unbelievable that something can make such an impact on a country and that you can get such results. I think there is no limit to what a patient forum can do.
I had misconceptions about cancer. The main objective of telling the story is to help other people who don't know much about cancer and its treatments. I felt satisfied that what I've given out of the forum is going to help other people in the future.
I appeal to the decision makers at this forum to do the right thing by placing cancer as a priority. I envy you because you are in a position to make a positive change to people's lives, people who are suffering. And to my mother, I love you beyond words. You are and always will be my hero.